Hello, everyone, and thank you for joining us. We're going to get started in just 2 minutes and allow everyone to log in. Thank you, everyone, for joining us today. We're going to go ahead and get started, and I'll hand it off to our Executive Director, Laurent Hubert.
Sorry, forgot to unmute. Welcome to this webinar for the public health community on the topic of what the role legal resource centers play in advancing health and tobacco control, and how they can also help drive a cross-sectional collaboration to drive policy change. We generally have registration from people all over the world, but many of you are from the United States. Very, very quick background on ASH. ASH was formed in 1967. And until 2000, its main mission was to protect non-smokers' rights, and its focus was mostly domestic in the US. But in 2000, it shifted, took a more comprehensive as well as global approach to tobacco control. And its goal shifted to protect everyone from and everyone's rights from harmful tobacco products, protecting both non-smokers as well as people who smoke from the harms caused by tobacco. And as I mentioned, we expanded to a global approach and took a key role in supporting the development of the Global Tobacco Treaty, the WHO Framework Convention on Tobacco Control, which is an evidence-based treaty that enshrines the minimum standards on tobacco control and provides a guidepost for countries to ship domestic tobacco control. The treaty is now joined by 181 countries and the European Union. ASH then worked to carve tobacco out of trade agreements, international trade agreements. We also work to integrate tobacco in the UN Development Agenda, the Sustainable Development Goals, and now we work to integrate tobacco in the UN Human Rights Agenda, such as the UN Human Rights Council. We're also very interested in, and we work on novel endgame policies to help the world lower smoking prevalence rates. We're involved in legal cases, such as currently engaged in a legal action against the FDA for not taking adequate action on menthol, which would protect African Americans, and also we also support criminal liability cases. We are particularly interested in addressing the supply side of tobacco products and really rethinking cigarette sales and the retail environment, and policies that would help phase out the commercialization of tobacco products, while also taking into account the needs of people who smoke and are addicted to tobacco smoke. Today we have 3 great speakers who will describe how they've successfully collaborated and how their work led to the recent adoption by Maryland of the Tobacco 21, the increase of the minimum legal age of sale from tobacco for tobacco products from 18 to 21-year-olds. Quick housekeeping issue: if you will have time for quick Q&As and for questions and answers later, but you can type your questions already during the presentation on the Q&A box, which you can see. For me, it's at the bottom of the screen, and you can address them to a specific speaker. So I want to welcome our first panelist, who's Blair Inniss from the University of Maryland Legal Resource Center for Public Health Policy. She will describe how the LRC worked partnerships with nonprofit organizations as well as the Maryland Department of Health to advance tobacco control in the state of Maryland. Blair, please go ahead.
Hi, everybody. Good afternoon. My name's Blair Inniss. I'm the senior staff attorney at the Legal Resource Center, and excited to be here. So I'll get started. Next slide, please. So the Legal Resource Center is funded by the Maryland Department of Health, and we operate in partnership with the University of Maryland Carey School of Law. We're located in Baltimore, Maryland. And although most of our work is specific to the state, we do track and analyze federal laws and policies and national trends as well. The creation of our resource center was in response to the Master Settlement Agreement, which was signed in November 1998. And as a brief refresher, or for those of you who aren't familiar with the MSA, it's an agreement between the major tobacco companies, which the tobacco companies that have signed on have changed over the years, 46 states, the District of Columbia, and 5 United States territories. And this was the largest civil litigation settlement in United States history. It resulted in the tobacco companies paying the states and territories billions of dollars in yearly installments to serve as compensation for the taxpayer dollars that have been and continue to be spent in connection with tobacco-related diseases, which also result in loss to local economies. So money from the Master Settlement Agreement didn't actually flow into the state until 2000. So between 1998 and 2000, the Maryland Department of Health considered ways in which the state could support law and policy work. And that was kind of the impetus for the Legal Resource Center. And that is how our first budget was created. So the function, we keep our function very broad. So we say creating support for law and policy work. And we do that because this is an ever-changing landscape. And so we want to be able to do the work that is most useful and most effective at the time that it's being done. In our first year of existence, we kind of needed a springboard. So we did this needs assessment to get a sense of specifically what we could do at that time. And in this process, we met with our local health departments and community coalitions that were aimed at curbing youth access and use, and nonprofit organizations and just general stakeholders to get a sense of what they all needed help with. In Maryland, we have 24 counties, and therefore we have 24 local health departments with different goals, perspectives, and populations. And so, and at that time, we didn't have a lot of federal tobacco regulation to work from and very little state regulation to guide us. And so we were spending a lot of time at that time seeing what other states were doing, taking what we could from the work that the counties were doing, and really seeing what would be most beneficial to get started with in the state and at local levels and how we could do that. Next slide, please. So when we talk about the evolution, possibly, or a convenient way to talk about it really is to look at it in 3 general time periods. So the first time period, right at the beginning, right after the initial needs assessment from 2001 to 2009, we just really began implementing our memorandum of understanding with the Maryland Department of Health. Just as a side note, initially our contracts with the Department of Health were for 2 years. And then over time, we found that in order to really be more effective in the quality and the extent of the work that we were doing, it made more sense to switch our contracts to 5-year contracts, which has been really helpful in us just really having long-term projects that we're working on. So in that beginning time frame, though, relationship building was a huge part of what we needed to be doing because nobody knew who we were. So we were regularly checking in and communicating with our local health department staff who deal specifically in tobacco use in the community. All of the local health departments have tobacco coalitions or local health improvement coalitions or the like that meet. And so we actually do attend those meetings as often as we're able. Again, just getting a read on what they need in the community. Oftentimes we attend these meetings and we are responding to questions about certain laws. Oftentimes, other times too, they actually ask for us to give formal presentations, which we are always so excited to do. And then during the legislative session, I think that is the most fun time in this job. And it's definitely an area where the Legal Resource Center shines. And we are able not just to work with the local health departments and the state health department, but also the Maryland General Assembly and the legislature and their staff and legal counsel, and really just being the subject matter experts in tobacco policy and control, and helping to answer questions as needed. As far as local legislation went in that initial time frame, a big thing that we were working on was local Clean Indoor Air Act laws, which actually then guided the 2007 passage of the statewide Clean Indoor Air Act, because by then about 60 to 70% of Maryland's population was already covered by these laws at the local level. So it made great sense to pass it as a statewide measure. So moving on to the next time frame, 2009 to 2016. So in the beginning of that, the big thing was the then President Obama signing the Family Smoking Prevention and Tobacco Control Act, which gave the FDA authority to regulate the manufacture, distribution, and marketing of tobacco products, which at that time included cigarettes, roll your own tobacco, and smokeless tobacco, which is authority they previously didn't have. So our role shifted some in that because we needed to be analyzing those provisions and really helping the state and local governments in Maryland understand how that interacted with their ability to enact and enforce laws regulating tobacco products. Also, so many federal challenges to the Tobacco Control Act, which we're still seeing. And those are things that we've been tracking all along, interpreting any guidance that comes out of these, not only out of these challenges, but any federal guidance that we get from the FDA. And really just making sure that at the state level and at the local level, we're not just following state and local laws, but also making sure that we are not interacting with federal law. And then that time frame also more towards the end, electronic smoking devices. We have our youth vaping epidemic that started up towards the end of that time period. And really just the general explosion of the popularity. We started seeing legislation both at the state and local level, although no federal regulation yet. And we really needed to beef up our own understanding of these products, tracking the public health research, tracking the trends across the country, because we wanted to make sure that any of the policies that we were recommending were going to be practical and good policy. So a lot of research in that time period and a lot of time spent still on electronic smoking devices and what we're seeing across the country. And then as far as, and then 2016 to present, the deeming rule, it became effective in August of 2016 and extended the FDA's regulatory authority to cover all tobacco products. So that included electronic smoking devices now and pipe tobacco, cigars, hookah, dissolvables, and e-liquid. So again, another time when we were spending a good deal of time helping our locals and any stakeholders in the state really understand what these new regulations mean. And a big thing we worked on was understanding what, if any, gaps still existed in the law and how Maryland could work to fill those gaps. We had and continue to have a good number of questions centered around youth cessation, youth use of electronic smoking devices, and then school resources and school programming that can help with that. And so given the nature and the extent of the youth addiction, especially around flavors, our role continues to be very responsive to that, among other things. And then our legislative priorities right now continue to be very closely tied to electronic smoking devices, flavored products, of course, so huge right now. Taxation, we actually don't tax electronic smoking devices in Maryland yet. Licensing, product placement, civil citations. So anything related to electronic smoking devices, those are big legislative priorities for us currently. And of course, Tobacco 21. Next slide, please. Which I don't want to spend too much time talking about because Jocelyn is going to talk in greater detail. So I'll just say that we know that there is a growing body of research that suggests that raising the age of sale to 21 has the potential to significantly reduce the number of youth smokers who ever begin smoking, since 90 to 95% of people begin smoking before the age of 21. So this is a national movement that really took off, and we were excited to have it come to Maryland and to be working on that. So as the Tobacco 21 campaign that came to Maryland, the Legal Resource Center was really there to, again, provide our subject matter expertise. So we were able to share the history of tobacco control in Maryland generally, give details related to bill drafting, even just small things like terminology, why we shouldn't change some terms, what the changing of a term would mean to other parts of the Maryland code, because of course we were not just working in one section of the code, we were working in many, and they have to all work together. So we needed to make sure that one change could carry over. Providing information on how local enforcement programs work. We worked closely not just with the campaign advocates like the American Heart Association, the American Cancer Society, but also with our state government. The Office of the Comptroller was a huge partner that we worked with as well. So really leveraging the relationship building that we have been doing from the very beginning. And the other thing we were able to do is work or assist legislators as needed, because we spend most of our time in Annapolis, where the General Assembly meets during the 90-day Maryland General Assembly. We've built good working relationships with a good number of the legislators and their staffers and their council. And so when they have questions, they are, hopefully all of them, but at least some of them, are comfortable reaching out to the Legal Resource Center, specifically the director, Kathy Hoke. It's not unusual for her to get like a text message every once in a while asking questions. And so we were always happy to answer questions. Lots of things around like retail employee, lots of questions about retail employees. In Maryland, we had this military exemption. So we were able to give more information on what the military exemption really means. And we were able to get in touch with members of the military who could give us more information on the military perspective on whether or not military members should be exempted from the Maryland Tobacco 21 law, things like that. Next slide, please. So broad strokes, some of the work that we do here at the Legal Resource Center, and then some considerations based on our personal experience that someone who is looking to create their own Legal Resource Center could think about. First of all, the source of funding. Again, ours comes from the Master Settlement Agreement, and it's funneled through the Maryland Department of Health, who contracts with us after we submit a response to a request for proposals. And then partnership with academia. This has been really beneficial to us. First of all, our overhead is significantly reduced because we can use university resources. Also, it's really exciting the way that we can collaborate across fields. And so we are part of the public health law clinic at the University of Maryland, and we work very closely with we recently have been working with the immigration clinic. We work a lot with the environmental law clinic. So it's really exciting that we are able to collaborate with these other academics and other programs. And then maybe my favorite part is that because we work with law school, we are actually able to provide learning opportunities for the students. So we have a class every semester, and we get free labor from these law students, and hopefully they get a lot out of it, but they are so valuable to the work that we do because there's only 3 of us, the full-time staff. So we definitely need the help where we can get it with our students. Starting with the needs assessment, like I said, we were very broad in our mission, so we are able to be flexible in changing based on the true needs of our clients, basically. But starting with that needs assessment was really helpful just to know where we should begin. And so really making sure that you involve as many of the partners as you're able to when you're doing that assessment. So I work extremely closely with the local health departments primarily. So for me, it's always important for me to step outside of my kind of comfort and immediate frame of reference to talk to, especially the local councils, which is strangely, or maybe not strangely, they often have different opinions than the local health departments, and then broader state legislatures and nonprofit organizations as well. And then kind of related to that, we have discrete deliverables, things like we have an annual conference, we have a set number of meetings that we attend, but also we are adaptable, and our contract is adaptable because things are just changing so much, especially now, especially related to electronic smoking devices. So that flexibility is very important to us. And then finally, creating resources. There are so many resources that are already available online. So we often will start with we have a lot of great partner resource organizations that we can go to, and they have free resources online, for instance. So we can always start there and then adapt as we need to for Maryland specific information. But we never recommend starting from zero on your own because it's not necessary and you're giving yourself significantly more work than you have to. So that's it. One more slide, I think. So this is my contact information. I'm happy to answer any other questions. And that's all I got. Thank you.
Thank you very much, Blair. Our next speaker is Jocelyn Collins with the Maryland and Washington Government's Relations Director of the American Cancer Society Action Network. And you go ahead.
Thank you, Laurent. So really appreciate the opportunity to speak today. Really wanted to first start off and talk about how this was a community-driven effort that was successful because of a cross-sectional collaboration with partnerships with the national health organizations, such as the American Cancer Society Cancer Action Network, American Heart Association, Campaign for Tobacco-Free Kids, as well as American Lung Association, with the Maryland Legal Resource Center, as well as the Maryland Department of Health, and the 65+ organizations in the Maryland Tobacco-Free Coalition. This legislation did not just happen overnight. It was a 5-year lift. This is significant because we were able to pass legislation in 2019 because of a changing of the state legislature, the e-cigarette epidemic that was arising, the 2 members of leadership actually sponsoring our bill in the General Assembly, and the backing of the 1/3 of the majority, which just happened in the changing of that election cycle, of the state legislature to be 1/3 of the members being members now of the Legislative Black Caucus in Maryland. Additionally, we were prepared. Again, this was a 5-year effort, and it was because of partnerships we were able to pull through. So before I get started, I really want to go into, as Blair mentioned, talking about what is Tobacco 21. So can we go to the next slide, please? Thank you. So Tobacco 21, as Blair indicated, is a national campaign that it was aimed to raise the minimum legal age for tobacco and nicotine sales to 21. Maryland was the 9th state to pass legislation and the 13th state to actually sign this legislation into law. The law went into effect on October 1st, 2019. Next slide. So a little breakdown of the bill. So the bill actually contains, of course, fine structures and penalties. The first being that, and this is really important, the penalty is on the retailers, not on the sellers. There is a $300 violation it's a civil penalty for those who violate, $1,000 for the second time, and then $3,000 for each subsequent violation occurring within 24 months after the preceding violation. One of the big and significant changes within the bill, again, that Blair indicated to, which we even talked to, of course, Legal Resource Center about and really got feedback on, was definitions. So one of the huge changes is that we actually changed the industry term of electronic nicotine delivery systems to electronic smoking devices. This is significant. This is the industry term that was used for years. It wasn't actually did not include all types of electronic smoking devices. And we really changed the definition and included all types of products in this. We also merged the definitions in the state of Maryland for tobacco products. So we actually included all tobacco products underneath the same definition. This was a big, of course, lift. Before, everything was separated out. And then finally, we actually had a government, of course, issued a government ID requirement where, of course, those retailers actually had to check IDs and really wanted to enforce that. Next slide. So one of the big things that this bill is actually repealed PUP in Maryland. So we removed a civil offense for purchase, use, and possession on minors. This was a big lift. And with the help of the Legal Resource Center and Department of Health, we were able to do this. In terms of compliance checks, we actually made sure that added language in to ensure that Department of Health could conduct unannounced inspections on licensed retailers to ensure that these licensees were actually being compliant. A huge part of this was also making sure we actually put into law that the Department of Health could utilize those under the age of 21 to assist in conducting an inspection. Finally, we also did 2 vending machines. We included vending machines in this legislation and ensured that vending machines were covered under this law. And then in terms of military exemption, while we did not want this of course happened closer to the end of the legislative process. We'll get into this more in the end. There was an active duty military exemption that was added in last minute. Next slide, please. So why tobacco 21? Why the number 21 is the $1 million question. Next slide. So the American Cancer Society, Cancer Action Network, American Heart Association, the American Lung Association, Campaign for Tobacco-Free Kids, and other public health groups always stand on the data before we take any steps on advocacy. So the health benefits laid out in the National Academy of Medicine report in 2015 were great, and we knew that we had to do something, and we had to do it now. And of course, we knew that we couldn't do this alone. It was a group effort that had to be done for us to achieve success. So we knew that tobacco use would decrease by 12% by the time today's teenagers or adults, and smoking-related deaths would decrease by 10% from this report. We knew that smoking initiation would reduce by 25% for 15 to 17-year-olds and 15% for 18 to 20-year-olds. And we knew that nationwide, this will prevent 223,000 deaths among people born between 2000 and 2019, including 50,000 fewer dying from lung cancer, the nation's leading cancer killer. Next slide. So again, it goes back to, we knew that smoking addiction really starts at a young age. Virtually all, so basically 94% of adults who smoke started by the age of 21, and half of these adult smokers become regular daily smokers by their 18th birthday. This is significant. The goal of this policy was simple. We really want to save lives and prevent you from even initiating in the first place and developing the lifelong addiction. Next slide. Nationally, here's the data at the time. Nationally, 95% of adults who smoke started before the age of 21. We knew that adolescents and young adults were a critical population to target evidence-based strategies such as Tobacco 21. We knew significantly the public health impact of this. This was a time period when the brain is fully developing and including the parts responsible for decision-making, which is really significant. And impulse control, sensation seeking, and they're more susceptible to peer pressure at this time. Next slide. So a look into the data back in 2018. So we knew at the time there was 21.6% of Maryland high school students who were currently using some form of tobacco products. We knew that 18.2% currently smoke cigarettes, 6.2% currently smoke smokeless tobacco, 9% smoked cigars, and 13.3% currently use electronic smoking devices. Next slide. So because of this, from the 2016, and that was before that, that's actually provided by Department of Health, we knew that there was a significant increase specifically on the use of electronic smoking devices, as well as, of course, cigars and the use of cigarettes. We knew we were going to have obstacles going into this. We knew from our past experiences in the state legislature where we're going to be significant milestones we had to achieve. But again, it's a changing regard, changing of time. And of course, we also had a national, e-cigarette epidemic that was arising as well. So we could relate to the fact that it was happening not only in our state, but nationally, and this was a growing problem that needed to be fixed. So we actually, some of the obstacles I'm about to talk about were actually turned opportunities because of our partnerships and our cross collaboration. And because we were prepared for the moment, we were able to succeed. Next slide. So one of the big things I pointed out earlier, it was progressiveness of this legislation. At the time that we, in 2019, we worked this bill to the state legislature, again, we were changing of the guards. Our speaker actually would pass away actually on the last day of session, sadly. But we also had a change of leadership. We have a lot more progressive members coming into the state legislature. Our demographic of our legislature had changed slightly. And we had folks who were really interested in making sure, ensuring that public health was a priority in Maryland. And one of course, big things that came out of this though was because of progressiveness of this legislation, we had some who also questioned, was the rise of the epidemic really a thing in Maryland? And we were able, because of the data that we had from the Department of Health and their support, we were able actually to even break data down by different counties and jurisdictions to show does that issue and need and products that these youth were using. And more than that, also Legal Resource Center also provided us with additional information as well and support actually on the hearing day and testifying as information purposes as well on this. In terms of enforcement and policing adults, that's another big, of course, issue in terms of enforcement. One of the big things that came across was that they were concerned about youth and them actually going in to try to buy these products and working with the Department of Health on this. We were able to actually show how other states were doing this, and this is where Department of Health came in, of course, the Legal Resource Center, and showing how we were able to, how this worked in other jurisdictions and how this will work in Maryland. Additionally, there's of course, conversation around policing adults. When is an adult actually an adult? That was of course, huge issue that came across because of our cross collaboration with our coalition. We were able to use, of course, public health experts. Johns Hopkins University came out and really spoke on this as well. And we were able to really address this and hit it at the nail. In terms of the business aspect, that was another big issue that came up, and the impact on businesses. Johns Hopkins University actually wrote up a report for us and actually went through and detailed and did a whole study on the impact on the state, and that was very significant because the numbers actually from the physical department in our state legislature was actually, budget department was different from actually Johns Hopkins, and they actually ended up going back and fixing that and editing the physical notes. So that was very significant. So that without that, it would actually hurt our legislation in the end. In terms of the military exemption, of course, that was a last minute thing. There's something that was actually brought up in the House initially during the hearings, and then actually the House was able to, and it put up as an amendment, and the House was able to defeat it. Actually, we had a veteran who sat on the committee the bill was in, who actually did a wonderful speech on the floor about this and why of course military should not have been exempted from the bill. Unfortunately, in the 9th hour in the Senate, when the bill was sent back over, our Senate president at the time noted that if we did not add the military exemption back in, we would not get the legislation through that year. So, and he would not sign off on it. So it was because of that, we had to, of course, accept the military exemption at the time, but we knew we were going to come back, if not that next year, to, of course, fix it. But of course, federal tobacco 21 ended up going into effect, so we did not have to worry about that. But within that process too, like Blair indicated, the Legal Resource Center also helped us with getting additional military veterans and so folks who are actually in the military to comment on these concerns, as well as Department of Health was able to weigh in on, of course, how this would actually be implemented. And there's questions on that too that came directly to the Department of Health. So that was really important. And we were able to work collaboratively to ensure that these obstacles bills were actually opportunities that benefited us. So next slide, please. So again, how do we achieve success? It was all about partnership, 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 cross collaboration. Next slide, please. So again, there was the Maryland Tobacco Free Coalition, which was actually the 65 plus organizations, including some of the national health organizations that you see on the screen, as well as the Maryland Legal Resource Center and the Maryland Department of Health, and the Legislative Black Caucus of Maryland, who actually made the bill one of their priorities. Our bills end up also being on a leadership package as well that year. We really had a successful campaign, but I can again point more to the fact that if it wasn't for this cross collaboration, the preparation, and working throughout the process, we would not be successful as we were that year. So if you go to the next slide. This is our victory lap. Not everybody who was, of course, on the bill was here unfortunately here at the day of the photo. They actually sprung it on us the night before that that it was going to be the day for the bill signing. The cool part was that our governor decided to make it a part of his first series of bills that he signed, and it was exciting. So some of the people that you hear speaking today were actually on the screen as well, in this picture as well. And again, if it weren't for these people here, or the folks who are not here, this cross collaboration, we would not be successful. So again, a 5-year effort, we did it. We did it by working together. It was hard at times, it was tough at times, but we made it through. Thank you.
Thank you, Jocelyn. So we heard first from someone representing a legal resource center based in an academic institution, now from the NGO, civil society, the American Action Network. And our third speaker represents a government institution. So Alanna Biblow, with the health communications, the health communications coordinator for the Maryland Department of Health Center for Tobacco Prevention and Control. And she will discuss the Maryland Department of Health's effort to provide outreach, resources, education, and enforcement in collaboration with state and local partners to ensure the law's effective implementation. Alanna, please go ahead.
Thank you so much for having us all. I'm excited to tell you a little bit more about the implementation stage of the Tobacco 21 law in Maryland. So if you go to the next slide, and the next slide after that. Thank you. So as you heard, Maryland was the 13th state to pass the Tobacco 21 legislation. So Jocelyn did a great job going through the law and all of the aspects of that, so I won't go into detail of that. I do just want to mention our partnerships that you've also heard quite a bit about, and the impact that it's had. I will obviously be talking a lot more about that through the presentation, but just want to mention none of this would have been possible without these partnerships between the Department of Health, the Legal Resource Center, and the Maryland Tobacco Control Coalition. And I do also want to note that the Tobacco Control Coalition that you just heard about from Jocelyn, that's actually an evidence-based requirement of CDC funding for the state to have. So this is something that we are A, required to have, but B, it is such a benefit for us to have something like this, that it's a coalition full of stakeholders and experts in the field that we are able to check in with, to have as an advisory in some capacity, and to have them as people to push forward such amazing tobacco control work. And then we also have the Legal Resource Center as expertise in the legal resource field, or in the legal field, and have them for technical assistance for both ourselves at the state level as well as the local level, and all of our partners as well. So we are very lucky to have this set up for us. So if you want to go to the next slide, I also want to give a little bit more background in terms of our efforts that we've had already in terms of this retail experience. So I'm not sure if people are familiar with the signer regulation, but that has to do with all states of the United States are making efforts to reduce illegal sales of tobacco products to minors. And with the signer regulation, there is an expected cap of a percentage of illegal sales that can happen in each state. So there's a 20% cap. Back in 2014, Maryland was out of compliance and went above that 20% cap of illegal tobacco sales to minors. As a result, there was a penalty given to Maryland to address this and make a change. So 2014 and 2015, we were out of compliance for both. So to address these issues, if you go to the next slide, It was good. Okay, thank you. Maryland developed these partnerships, and these partnerships were instrumental then and continued to be instrumental throughout all of our efforts. So we worked with our health departments, our local health departments, our Tobacco Control Coalition, our Legal Resource Center, and we also worked with our Maryland Comptroller, which you heard was so instrumental with the Legal Resource Center. They were also instrumental with our work here. The comptroller does a lot of enforcement. They also work with the retailers in terms of licensing. So the state of Maryland requires any tobacco or vape retailer to have a license to do so. And they collect all that information, and we are then able to get that information from the comptroller so that we are able to do direct outreach to those retailers. So it's a very great opportunity for us and to increase communication that way. We also did outreach to the Maryland Retailer Association and develop partnerships with them to really understand how we can best work together to reduce the non-compliance rates. And we also worked with our Office of the Maryland Attorney General as well. So all these combined efforts were done to really work on those signer non-compliance rates. And if you look on the other side of the slide, you'll see that those efforts worked to develop this, what we called our Responsible Retailer Initiative. So 2014, 2015, our state was out of compliance. And then if you see after that, all 5 years, we've been way below that 20% cap. So we're very excited about our success, and we hope to continue it, especially now that we are moving towards Tobacco 21 laws. So if you want to move to the next slide, I will talk more specifically about our Tobacco 21 efforts. So we did a lot of outreach to talk about this as soon as the law was implemented. If you go to the next slide, I'll talk a little bit more about each individual effort. So as soon as the law was signed, we put out a press release at the department about Tobacco 21. At that same time, we were developing frequently asked questions. We knew this law was a little bit complicated, especially with the military exemption. So we really wanted to make sure retailers, as well as our local health departments and any of our other partners, were as informed as they could be. So we worked very closely with the Legal Resource Center, as well as other states like California, who had done the Tobacco 21 law much earlier and also had a military exemption in their law, and learn from them really to see what FAQs or frequently asked questions would be helpful for retailers as well as the general public. So we worked on these FAQs and we posted them to our website that's specifically designed for responsible retailers that came out of that initial initiative. We posted that back in June, and that was a working document. We constantly, as more questions came in, as more retailers came up with new questions that we hadn't thought of before, we added those to this document and continued to keep it live. So we go to the next slide. Great. So these are some of the frequently asked questions we got. These actually, I think, were referred to already in the presentation. Things like, can clerks who are younger than 21 sell tobacco products? And then we had a lot of questions around military. If you go to the next slide, you'll see why I may not go into detail, because the federal T21 law was put into effect in December. That was 3 months after our law went into effect. And that law, for the federal law, did not include an exemption for military. We learned through working with the Legal Resource Center, as well as our Office of the Attorney General, that meant that the Maryland law was, the Maryland exemption would not be in effect either. We had then advised retailers and put all this information on our website that the expectation was that federal law supersedes state law, and that Maryland retailers should not be selling tobacco products to anyone. There are no exceptions for anyone. So we really tried to make that as clear as possible, because that law is confusing. There are the differences in the two laws, but we really tried to make that as clear as we could, and have been continuing to make that as clear as we could. And that was really thanks to the Legal Resource Center for explaining that and for clearing that up, as this law really, the federal law kind of was a bit of a nice surprise to see that happen. So we can move to the next slide. So we also did some more awareness work, working with our retailers and partners to make sure people were aware of this law. So once it becomes in effect in October, they were aware that it was not a surprise to them that this was happening, and they could be as prepared as possible. So we provided letters, we did postcards. We also worked with the retailers to figure out how we could improve our retailer campaign. We had previously done some signage and educational work before around responsible retailing, we wanted to kind of make a new, more eye-catching campaign so that people would, particularly retailers and maybe their customers, would pay attention that there's a new law and there is a new age for tobacco sales. So we reached out to retailers to see what design from our ad agency they really were attracted to. So they all unanimously chose this one that says 21 or none on the postcard. And so we were glad to have that buy-in from retailers, that interest from them in this process. And then working closely with our media contractor, our local health departments, and our other organizations that really provided education and enforcement as well. And then throughout the process, we developed more materials. You go to the next slide. Our Legal Resource Center really helped us to address all of these materials and ensure that they were accurate and well-informed, that our retailers, once they received them, could ensure that this information was as accurate as possible. So this included anything from there's Maryland and federal tobacco law graphics, local law charts. We have more detailed information about the laws. We also have a retailer quiz that we provided. And as it was mentioned too by Blair, we talked about the military ID as well and the exemption there. We provided a specific guide on just on IDs alone. The Maryland licensure, we already have 4, I guess, different kinds of IDs for licenses here. We have 2 of the older versions, one for people who are under 21, one for people who are older than 21. And then we also have this new real ID that's required. And then on top of that, we had this military ID, and there's so many different variations of that. So we really needed to nail down what retailers needed to look for if they were trying to work with this exemption. So there was a lot of connecting with military on our end, and thankfully through the Legal Resource Center and all the work that they did to really nail down these details. It was instrumental to making sure that this information got out there. We also worked to put this all on our website and mail these directly to retailers as well as the local health department, so that they all had the tools that they needed to implement this effectively. We can go to the next slide. The other side of this was the posters and window clings that were required. Part of the language in the law was that retailers had to have signage with the required language displayed in the store, mostly so their customers would know about this. But there was such specific details in that that we worked very closely with our ad agency, as again, our Legal Resource Center, to ensure that we were following the law to the letter of the law, as well as our Office of the Attorney General, to make sure that we, again, were making sure that, so even as things as much as the font size had to be a certain size. So we really needed to get these details down and also alleviate some of that burden on retailers to make sure that they were following the law. We wanted to provide that signage for them. But then when the federal law came into effect, we had a lot of questions about how that impacted that specific language. Through the partnerships that we had, and specifically the Legal Resource Center had, with the comptroller and the Office of the Attorney General, we were able to really answer these questions fairly quickly about how to handle this, how will the comptroller handle enforcement checks of this specific signage. And I think without those partnerships, we might not have been able to have such a quick turnaround of a solution for this, of being able to say, we're not going to enforce the signage aspect of it, and then be able to having a partnership with our local health departments, and being able for the Department of Health and Legal Resource Center to filter that message to the local health departments, and then for them to have the connections with the retailers and for them to provide that message to the retailers as well. There's such a good connection between all of this to be able to get this message across. The communication was such a key part of these partnerships to get this going. So let's move on to the next slide. So another part of the communication and outreach was the work we did to really, again, get this message to everyone that needs to know. So we did advertisements on LinkedIn, on Google AdWords. We also did advertising on transit, like buses and shelters, bus shelters across the state. And we saw a difference in our website analytics. At the bottom of the slide, I think it's cut off a little bit, but you can see in October, right around the time of the law going into effect, there was a huge spike. We had about 8,000 unique visits within just a 2-week time period, which for this very specific website, that was a lot of visits. So it was a great thing to see that people were interested in reaching out and getting the information that they needed, whether they were retailers or local health departments. We were happy to have that information. We also did outreach to universities and colleges in the area because this law would also impact their students since they were right around that college age. So we made sure that we notified them and said, you know, this law is changing. This may impact your students. This may also impact your out-of-state students. So be mindful to educate them about these new laws and how this may impact. Because the law in North Carolina may be different than the law in Maryland regarding the age of sale. So we really try to have those conversations and education. Move to the next slide. Okay, so I know we're short on time, so I want to just quickly note that we did have a retailer survey as well. We tried to assess the awareness level, support, and the impact of T21 on retailers. We did a pre-survey, before the implementation. We did that in September, and then we did a post-survey this past June, all with retailers, owners, managers, clerks. If you go to the next slide, I'll show you the results. So overall, it was really positive. We were happy to see that. They were mostly in support of the T21 law. 85% said that it had no or minor impact on their business. They were actually IDing more. They felt that this law was going to make it harder for youth to get tobacco products. So that's great. And then they also felt that it was pretty easy to comply with this law. The only concern they really brought up was that if their customers were upset, that would make it a bit harder to comply. And that is something that we are working on. So you go to the next slide. I think I just have some wrap-up thoughts of just really the main thought is here, partnerships are key. Partnerships were key to getting the law across, as you heard. Partnerships are key for us to get all this information out and have this implemented so that people were all aware, all the retailers were aware, and the local health departments were aware, and that these policies can really work to reduce to reduce tobacco use. And there's not a reason not to do it, right? The retailers were in support and they didn't really have a business impact from it and they were on board with it. So it was really all pretty positive, I have to say. If you go to the next slide, it's just my contact information as well as our responsible retailer website if you'd like to check that out. Thank you.
Thank you very much. So that was quite interesting and really shows how well really the need for a legal resource center, how useful it can be in moving policy forward, as well as the need for partnerships between government, civil society, and legal resource centers. And we see that even globally. I mean, even when we started the negotiations for the Framework Convention on Tobacco Control, not that many lawyers were involved in the process. And now we see that this is a critical need, and there's a number of legal resource centers that have been very helpful at the international level, like the McCabe Center for Law and Cancer in Australia, for example. It's even an official knowledge hub with the treaty and the FCTC, and they provide assistance to countries as they face challenges from the industry. But it's also, for example, I know the Legal Resource Center at the Campaign for Tobacco-Free Kids, which the Global Resource Center, which provide resources for international partners, and also the Public Health Law Center in the United States, which helps local groups. So we have a number of questions. Some came through the chat and some came through different channels. The first one I have for all of you, and because this process, when it started, when T21 was cutting edge at the time, and we have a question from Tom Novotny from California, and he's asking, as Maryland has substantial beach culture, has there been any interest in banning the sale of filtered cigarettes to reduce the burden of tobacco waste on beaches and in the urban environments, especially in neighborhoods such as Baltimore that are highly impacted by this waste? And I think it's important to join with environmental advocates in such efforts. And so I'm curious whether those type of very novel policies are being discussed between those, the three different entities, the Legal Resource Center, NGOs, civil society groups like the Action Cancer Network and others, and the State Department and the Health Department in Maryland. So it's a bit of a question for the three of you.
Well, I'm happy to start. I'm not familiar with any discussions related to banning filters. What I do know is that the beach in Ocean City and the boardwalk are non-smoking. And the big problem they're having in Ocean City is that people are throwing their cigarette butts right at the entrance to the boardwalk. So there's they've had, I want to say for the past 2 years, the Worcester County Health Department, which is where Ocean City is located, has been giving money to sub-grantees to work on I can't remember the name of the campaign. Maybe Alanna remembers it. It's really cute. Something about pick up your butts or something. It's a cute, catchy title. But they've been working on encouraging people either to use the receptacles that are right there, and for some reason they're choosing not to put their butts in, or to keep their butts on them until they get somewhere where they can throw it away. But I agree, the cigarette butts are a huge environmental hazard in all of Maryland. I live in Baltimore as well. I totally agree that it's a horribly frustrating and disgusting issue here. But yeah, I haven't heard anything specifically about banning filtered cigarettes, though.
I second what Blair said. Haven't heard anything as well. But I think one of the big conversations in the past, especially the past 2 years, besides Tobacco 21s, has been, of course, the flavors legislation. Of course, our tobacco tax that we are hoping for a veto override with the next session. And there's been conversations, of course, more so in terms of environmental lens on the Clean Indoor Air Act, and specifically e-cigarettes, make sure we have e-cigarettes added to it.
Alanna, anything to add on this topic?
I think what the program that they had out there is more of they were doing some kind of like a butt hut program out in Worcester,
Right.
where they would put these things at the entrances that you could put your litter away. The other thing I'll add is that we did have a litter campaign out of the state, where so if you go to notobaccoliter.com, it's just information about tobacco litter in general. We do a lot of this information around Earth Day and Earth Month, really. We try to do it the whole month, and talking about the dangers of tobacco litter, and the dangers that it affects animals and children, and just that kind of aspect of it, and really driving, hopefully, smoking cessation because of the concerns for the environment.
Great. My next question is a few questions in one. In terms of how many states have legal resource centers, because I suspect that's not every state has the luxury to have one. And if they don't, what other resources can they access to? The issue of funding, Blair, you mentioned that it came from the Master Settlement Agreement, and I believe that may not be an available resource for all states. And for example, in the state of Maryland, Alanna, you mentioned, for example, a fairly big communication campaign. How was that funded? So, sorry, it's a few questions in one, but please go ahead and.
So I'll just say for the mass media campaign that we have through the Responsible Retailer campaign, that does come from federal funds primarily. So we have a ad agency that we hired through this funding, and they help us to promote that. And then we do use, I believe, some state funds towards getting that out there. But in general, most of that is from federal funding that we have specifically so that we can bring down our non-compliance rates, which we have successfully done, as we mentioned. But really trying to get that out there with advertising in the various ways. And our media agency helps us with those placements, whether they're on buses or gas stations, and different ways that we can really get that message out.
Great. And Blair, on the issue then is such a resource like the one you have in Maryland, does that exist in a lot of states? And in terms of funding, if funding for the Master Settlement Agreement is not available, are there the other sources that you think could be a natural fit?
I'm actually not familiar with exactly how many states have a legal resource center. What I do know is there are a good number of legal resource centers that have a national focus. So for instance, we work with very closely and often refer people to the Public Health Law Center, which used to be called the Tobacco Control Legal Consortium. And they're amazing. They're amazing. So, but you're right that not every state has a legal resource center. And I think it is more of a hot commodity, and it's not available everywhere. As far as sources of funding goes, so the Master Settlement Agreement, most states are part of the Master Settlement Agreement. The ones that are not, it's because they actually already had agreements with tobacco companies. So it's not that those states aren't getting any funding. It's just that it's coming through a different mechanism. And I will also say that different states are able to use the master settlement dollars in their own way. And so in law, probably most states have the way that their funds are going to be spent. So even states that are, plenty of states that are receiving master settlement agreement funds aren't using even a portion of it for tobacco control. So that's the other consideration too, is the way that the funding is being used.
Great.
I just wanted to quickly, I just wanted to clarify that we also are using MSA dollars or master settlement dollars to fund for our media as well. I just wanted to clarify that.
Great.
Thank
you. Jocelyn, I have a question for you. You mentioned that basically the definition of tobacco products that encompassed a whole set of products, and I'm wondering, I suspect that differs from other jurisdictions. So how did you get to that? Because even, for example, within the even internationally, there's been some debate on this. So that was one. And then could you clarify also what you meant on the business impact, where there was some conflicting data from the state that was then clarified by Johns Hopkins University. Can you expand on that?
Yes. Okay. So the first part about the conflicting data. So, and for every bill in Maryland, of course, is a physical note attached to it. Essentially, the Department of Health, the physical department quoted, gave a number, predicted a number of, in terms of revenue loss, what it would be for businesses who, of course, retailers who sell tobacco products in the state of Maryland. So basically predicting the amount of loss, revenue loss based off the, of course, age demographic if they change it from 18 to 21. And that highly, of course, what happens sometimes too is the state will predict one thing, and then of course we as public national public health organizations, or of course those who are doing some of the research on this, just like Johns Hopkins does this on a regular basis for a lot of states, will predict the opposite. So that's what exactly, of course, happened in this case. And they, of course, went by more of Johns Hopkins. They went by Johns Hopkins numbers because, of course, they are the experts on this. They do this for, do this for a living. And they tend to, of course, give their of course, numbers who, of course, the people like Hopkins who know everything the best. In terms of the second question, in terms of the tobacco products definition. So one of the big things was that, and this is something that we saw across the country, not only in Maryland, was that the e-cigarette industry was trying not to actually label a e-cigarette as a tobacco product, even though we do know it is a tobacco product. And because of that, one of the big things was, and this across the country with Tobacco 21, in terms of model language, and something that was a growing trend, specifically because of Tobacco 21, was making sure we encompass all products in one definition of tobacco products. So that includes cigars, that includes other tobacco products, smokeless tobacco, just everything all in one. And one of the things that the e-cigarette industry did not want to do, was they did not want to include it under the definition of tobacco product. What they wanted to do was regulate, and we saw in other states regulate it separately, as they said it was not, quote unquote, a tobacco product. As we know, it is. And because of that, we were able to, of course, put that language in there and really make sure we clean up and even add some of the new products that came on the market in. So that the way our definitions are in Maryland, any new product that comes on the market is basically covered because of our comprehensive definitions. So that's something very important. And there is a model language, again, for those who are in other countries on Tobacco 21. And it's something that the, of course, national health organizations, Campaign for Tobacco-Free Kids, American Cancer Society, Cancer Action Network, American Heart Association, American Lung Association, and others have, and which we use for this.
Thank you for that. I'm conscious of time. I'm going to go just for the last question. Someone what does the youth access data look like in terms of breakdown between cigars and loose cigarettes for the sign-on compliance law? A person says, in the past, I remember CNR being focused on reducing access to cigarette packs versus looses, or even including cigars, the ones sold for 3 cents. Does anyone able to answer that?
So I am not the expert in signer, but I will just mention that it is more, loosies are not included in that. So I could say that at this point, at least, that unfortunately that would not be accounted in our sign-on numbers. And I don't know if anyone else has anything to add to that aspect.
Great. Well, I'm conscious of time. There's a few more questions, but unfortunately, we will not have time to go through them. But thank you, everyone, for joining us today. Next week, we have a whole set of webinars for the week of November 9th. Given that's the week that the negotiations for the Framework Convention on Tobacco Control were scheduled to take place. So we'll have daily webinars, and we have great speakers from around the world, including the head of the Framework Convention Secretariat who will be speaking. We'll hear from examples from Spain, South Africa, and others during that week. So we hope that you can join us for this, and you will hear more about that over the next weeks. And so please stay tuned. Thank you very much, and have a wonderful day. Bye.